is News 12 Connecticut, as local news gets. Now, the Daytime Edition.
And welcome back to the Daytime Edition. I'm Rebecca Saran.
I'm Jim Bunn. I'm in for David Smith today.
And millions of people, Jim, we were talking a moment ago, suffer from lung disease. I had no idea the number was that high.
Yeah.
But today we're going to find out how many can learn to live with these certain ailments and do so very comfortably. And it starts with skipping those trips to the hospital as often as possible with the right guidance.
Absolutely. Now, it's called Pulmonary Rehabilitation Associates, LLC. It provides a one-on-one in-home pulmonary rehabilitation program that we're going to find out more about today.
Yes, and joining us today is respiratory therapist David Junga, and he is, has with him a patient who has benefited from this approach, Eleanor Burks of Milford. Nice to have you both joining us today.
Thank you. Nice to be here.
Good morning. Thank you for having us.
We were talking a little bit about pulmonary disease, lung disease, and the number of people in this country that have pulmonary disease. Is it mostly emphysema? What are we seeing?
The prevalence of lung disease, especially in a situation called COPD, which is chronic obstructive pulmonary disease, which is the umbrella terminology for asthma, chronic bronchitis, and emphysema. That's the largest patient population base that we see. It's a situation where a lot of these people are oxygen dependent, or the common denominator is shortness of breath, and they have a very difficult time getting out of the home. They can barely make it to the doctor's offices that they really have to get to. They can't make it. So with this need in mind, I realized that I had to do something as being a respiratory therapist in local hospitals, to go to the patients and treat them in their homes, and a lot of the obstacles that they have to overcome is in their home.
How does it work?
We go into the home, we send a board-certified respiratory therapist twice a week for hourly visits, and we teach them proper breathing exercises and strengthening and stretching exercises while breathing correctly. That's the biggest issue, is the focus on the breathing.
Yeah. Eleanor, how did this change your life? What was it like before you went to and had this particular therapy, and then afterwards?
Well, I came home from the hospital and I wasn't walking. I had to learn to walk all over again because I'd been in bed so long. And David saved my life. I couldn't walk from here to there. And he taught me the breathing and nutrition and exercises, so that now I'm driving. I'm out all over the place now.
Was it emphysema? Was it asthma?
Emphysema. They told me when I left the hospital I had emphysema. Yeah.
And what was the prognosis that they were giving you at the time when you were in the hospital?
Well, I said, what's going to happen if I get sick again? He said, you probably die.
Thank you, doctor.
Yeah, right.
So this program has literally been something that has...
I saw David just as I was leaving, and I said, what am I going to do? He said, lucky for you, I just started a business, and I'll come to your home and take care of you. And he has saved my life.
How long does the program, the in-home program, and the training take?
We have two programs depending on the severity of their pulmonary condition. If it's a very mild to slightly moderate, it's a 6-week program, and if it's a moderate to severe, it's a 12-week program.
I have the 12-week program.
Are you able to increase the lung capacity through therapies such as this, or whatever diminished capacity you have at the time is what you just have to learn to cope with, and certain breathing therapies?
Breathing exercises, so that if I do panic, I do my breathing and it restores me immediately. Yeah.
Are there any other health benefits? Usually with some of these rehab types of programs, there are ancillary benefits that you have, whether it's reduced stress or...
Oh, absolutely. Yeah. I would be absolutely panic-stricken all the time if I didn't have this breathing, if I didn't have David tell me what to do. Yeah, really. Because the doctors send you home and you have a therapist and they teach you to walk a little bit and then do this and do that, and then they leave after 3 weeks. And you're sitting there, what am I going to do?